I think that both are very worthwhile goals. So it has been amazing what's been done for cancer treatment over the last 20 years. Truly amazing, and not just for breast cancer, all cancers. Dr. Dennis Slayman, the head of oncology at UCLA Medical Center, made truly one of the biggest discoveries in the history of cancer research when he developed the HER2/neu and protein, and subsequently developed a therapy based upon treatment directed against HER2/neu called Herceptin. It's revolutionized breast cancer treatment. There are a lot of women, even in my own practice, who have been getting Herceptin with stage 4 disease for a number of years and doing quite well. It has increased in newly diagnosed patients who are HER2 positive, markedly increased their disease-free survival. So, and that's not chemotherapy. So that's what is more in the targeted therapy realm. There are a number of other targeted therapies on the horizon. So new drug research, vaccine research, really looking at the human genome, looking at what we call single nucleotide polymorphisms, or SNPs, just little tiny nucleotide change in one gene can inactivate the gene. So BRCA1 and 2, those are tumor suppressor genes. One little abnormality in those, they don't work so much, and so you increase the risk of breast cancer. And we're looking at a lot of these now. So we know people with lower levels of detoxifying enzymes don't detoxify a lot of these carcinogens as well. And looking at insulin-like growth factor. There are a lot of therapies that are being looked at in relation to insulin-like growth factor, vascular endothelial growth factor, Avastin has been used. That targets angiogenesis. Again, a targeted therapy that's not chemotherapy. And there are a number of combinations of these type of compounds that are being used for a variety of different cancers and a variety of different stages. So clearly, research money needs to be put into this, because we're living in a country where 1 in 3 people develop cancer. We need better treatments, and we need that to continue to evolve. On the other hand, we also need to focus on something different than just the war on cancer. The war on cancer was first coined by President Nixon in the 1970s. He said we need a major push to find a cure for cancer. And since then, a lot of great therapies that I've just mentioned and many more have come out of that war on cancer. So that's important. But we also need a war on carcinogenesis. Carcinogenesis refers to the causes of cancer. All the environmental toxins that are out there, that are not just out there, they're in our bodies. Okay? So we have polluted a lot of the planet. And we've polluted our bodies. And clearly, I think that the fact that childhood brain tumors have increased dramatically since 1970, some cancer incidence has actually gone down, but many have gone up. And childhood leukemia has gone up. And I do believe that it's really no coincidence that we're seeing, an epidemic of learning disabilities, an epidemic of developmental disabilities. We're seeing the incidence of autism increase dramatically over the last 30 years. And I don't believe that any of these are occurring in a vacuum. So I believe there's a link between a lot of the illnesses that we're seeing and the environmental toxins that are ending up in our bodies. They're not just out in the environment. So there's no difference between the external environment and our internal environment. So we need a war on carcinogenesis as well as a war on cancer, a war on the causes of cancer, as well as treating it once it's already occurred. And I believe that's a war that really can help prevent cancer. I believe that by minimizing people's exposures to a lot of carcinogens, we can affect cancer incidence. And I believe that through a lot of the nutritional modalities that I've just discussed, we can also improve not only cancer survival, but lower incidence. Well, I think they're all talking about it. I've heard speeches where they're all more cognizant of the environment, and I am encouraged because that was not something prior to this presidential campaign you really heard people talking about with any regularity. And, it was about a year ago that there was an article on the front page of the New York Times. And the article was titled "The Death of Environmentalism." And they interviewed two researchers who contended that the reason people didn't care about the environment so much, or started to yawn or change the channel when somebody was talking about the environment, is because they just felt it was too big a problem, and there wasn't anything that they could do about it. But nothing could be further from the truth, because if people can understand that the environment out there is ending up inside you, it's affecting your health, it's affecting your children's health. And, having been through breast cancer with my own mother, I know what a toll it takes on families. And, from taking care of patients every day with a variety of different cancer, I know the toll that cancer can take. And clearly we know the incidence, cancer for Americans under the age of 85, it's become the leading killer. It overtook heart disease. So this is a big problem. And it's not a problem that just because it's big should seem overwhelming. It's a problem, we're very industrious people. We're a very industrious nation. We've had bigger problems and we've solved them. And this is about each individual getting this kind of knowledge, understanding about what it is they're putting into their bodies, how they can make their immune system strong, how they can make their detoxification system strong. This is about educating each person. And I think it's a great question that you asked earlier. What about people that don't have a lot of money? Well, maybe they won't be able to go out and buy organic milk, but they can do things like drink green tea and sensible things, exercise more. There was a study in the New England Journal of Medicine suggesting that up to 20% of women's cancers were related to just obesity. There's an epidemic of obesity in this country. And, the reasons for that are not enough exercise and too much intake. I think there are other factors that cause that as well. There are a number of chemicals, for instance, that we're exposed to that in animal studies have shown they make the animals eat more. Even when you cut the animals' caloric restriction and they're given a lot of certain pesticides and herbicide residues, they still don't lose weight. And there are a number of things people can do just by getting within their ideal body weight. We know that up to 25% of all cancers are related to diet. And we know, about the connection with sugar, with high insulin levels, with high insulin growth factor levels. So there are a number of things people can do.